right, more than 17 million American adults struggle with depression. And while we all know, right, there are a slew of therapies that can help, sometimes it's just not enough. A new treatment using ketamine is showing amazing success. It's now available here in Columbus. So in this segment sponsored by New Pathways Clinic, I'm happy to have owner Steve Suntala here to share more. So good to have you with us.
Nice to be here. Thank you.
All right, let's talk about kind of a general intro, Steve, just to your office. Tell me about the clinic and what you do.
Yeah, so we're a mental health clinic and we specialize in treating treatment-resistant depression, anxiety, PTSD, and we primarily use ketamine infusions and Spravato.
Okay, so to that end, ketamine. Let's talk to people about what it is. I feel like maybe we have a definition we might think, you know, from 20 years ago or such. Mm-hmm. What is ketamine and how does it help?
Well, ketamine's actually, it's been around since the 1960s and it's used every day in hospitals for anesthesia and for sedation. But we use it quite differently. We use it in a lot lower doses, low dose infusions to treat depression. So these are about 45-minute appointment infusions, and yeah, they produce rapid results.
Okay, and let's talk about the infusion. So that's the first one you mentioned, a ketamine infusion. So are you sitting there kind of hooked up to that? What is the process like?
Yeah, they come in and they get settled in. It's about a 2-hour appointment. So it's an IV infusion. They're monitored, their vitals the whole time, so we're monitoring blood pressure, heart rate. There's a nurse in the room with them the whole time to make sure that they're safe and comfortable.
Okay.
And yeah, it's a sub-anesthetic procedure, so you're sedated, but you're still conscious.
And then what about the nasal spray? Are you still doing that in the office? Are you taking that home? What is that part?
Yeah, that's still in the office because, you know, it's a controlled substance. It has to be done under the supervision of medical personnel, so that's called Spravato. It's nasal spray, S-ketamine. It's a little bit milder version. It's fully covered by insurance for most patients, particularly Medicaid patients. It makes it accessible. The infusions are a more efficient, more powerful treatment, but it's only partially covered by insurance. So we offer both to make the treatments accessible to the whole population.
Yeah, and talking about the population, Steve, what kind of conditions are you treating? You know, you mentioned this treatment-resistant kind of depression. So a lot of people who have, you know, these mental struggles have tried a million other things, right?
Yeah, most of our patients have been being treated for over 10 years, 20 years, 30 years, and oftentimes with very little to no success. Prescription medications are only effective for about half of the population, and besides therapy and prescription medications, there's really not too many treatments available to patients. So many patients have gone without relief for far too long, and this is a new treatment that has, you know, a 75% success rate at our clinic.
That's great.
And scientifically, it's been proven, you know, in hundreds of studies to be 70% effective, even for the most severe patients. So
yeah, those odds are good. Yeah. And you said you see a lot of patients. I was even just talking to you about a gentleman I was talking to, a veteran who went through some ketamine treatment and said it really changed his entire life because he had struggled for so long without any results. And so you see probably a lot of people with PTSD, right?
Yeah, it's one of our main patient populations. Trauma is a big problem, and it's not just veterans. A lot of women struggle with it, with the abuse within relationships.
Yeah.
And yeah, it's a very prevalent and hard to treat problem. PTSD is even harder to treat than depression, and we have wonderful results with veterans and all types of patients with trauma.
And when you say the results, are you seeing those right away in patients, or do they have to undergo these treatments for a while?
Yeah, that's the coolest thing about it, is that some people feel better after the first treatment, but even if not, it's a 3-week treatment plan. You know, 70% of our patients are no longer symptomatic after 2 weeks of treatment.
After 2 weeks, yeah. That's, I mean, amazing for a lot of these people who've struggled for so long. And you kind of alluded to this, Steve, but I was reading that there haven't been new treatments for mental health in over 30 years. And it seems so crazy because so many Americans every day struggle with that.
Yeah, and it's even worse. It's been exacerbated since the pandemic, which a lot of people are aware of. But yeah, it's over about 25% of the population struggles with some form of daily mental illness, and Yeah, there's been all sorts of new prescriptions that have come out in the past 30 years, but they're all derivatives of Prozac and some of the original
right, of what already
antidepressants.
existed. Yeah. Okay, so I want to let people know if they want to reach out, we have the website up there, the phone number. You can even go there, just learn more about kind of the processes and everything that goes on, but it is New Pathways Clinic. Steve, thank you.
Thank you. Thank you so much.